Hello everyone, welcome back to Fitness, Nutrition and Soul channel. Today we're going to talk about the infertility. First of all, I would like to say this is not a medical advice. We're only going to discuss some of the nutrition and the lifestyle reasons which can be related with the infertility. Because there could be a million reasons out there. So I highly suggest, if you have any issues, you should talk to the medical practitioner. This is only for the awareness. This is only to guys make you more educated that some of the aspects which are related with the nutrition and your lifestyle and the fitness, how it can impact onto your fertility. So let's start. So first of all, the infertility is considered when the couple cannot conceive the baby for 12 months without protection. Sometimes the couple can have a problem for 2 to 3 years, and I think up to 30 to 40%, some couples can still conceive the baby, even 2 years, even after considered as being infertile. And so let's start with some of the reasons for the infertility in the man, woman, and what's the common. So in women, there could be multiple reasons. So the thing which can be related with your lifestyle is, and your nutrition is, if your BMI is under 18.5 or if your BMI is above 30. So what research has found is a BMI between 20 to 30 is actually best for the fertility. So anything which is undernourished, so which is under 18.5, and the reason is it gives the signal to the hypothalamus through the leptin hormones that there is not enough fat in the body to sustain another life. So which can then interrupt your periods and stuff like that, and that can impact on your fertility. So the best way to actually fix that is to gain 3 to 5 kilos of weight and see how your body responds. And same with the same with the BMI above 30. When you go to the infertility clinics, and if you are overweight or obese, the very first thing they will tell you to lose the weight, because losing the weight can increase the chances of getting it increases the chances of conceiving the baby. The another one is the age above 35 years. So in women, if the woman is above 35, it actually reduces the chances of the conceiving. And the reason is because with the aging, it damages the chromosome, the egg doesn't mature properly, and there could be other reasons out there. But so aging is one of them. And then the polycystic ovarian syndrome, and then you got the oral contraception. So with the oral contraception, then you're gonna stop it and try from like 6 months to a year and see how your body responds. And then the anorexia or bulimia, which I discussed before. Anorexia is generally when you're because of the body image. Some of the women don't eat the well-nourished diet, especially the diet can be very limited, which can be low in iron, which can be low in folic acid, which can be low in iodine and other micronutrients, and that can so there's a true type of the malnourished. One is the acute and one is the chronic. So the acute one is when suddenly you are being eating healthy, and due to any given reason, either because of the crash diet, extreme diet, or due to the feminine, you stopped eating the well-nourished food for a few months or a few weeks. And the chronic is when the woman is deprived from the essential nutrients, the macronutrients, for a long time. That can impact on the fertility as well. Another thing, so poor iron stores, which I mentioned before, caffeine more than 300 milligrams. So what they found is that the woman who especially somewhere around 500 milligram, that can actually reduce the conceiving rate by up to 50%. And another one is the hypothalamic amenorrhea. Hypothalamic amenorrhea is the disruption of the your menstruation periods, and that happens when your diet is, especially either you're training too extreme to the point like training 2 to 3 hours, especially like the aerobic kind of pace for like 5 to 6 days, or you're not eating enough nutrients, that can actually disrupt your menstruation cycle. And when the menstruation cycle is disrupted, or it can be complete absence of the menstruation cycle as well, and that can also impact on your fertility. But most of the things which I've discussed in the women, except the aging, it can be, to some extent, can be fixed with your lifestyle. So making sure your diet is rich in the macronutrient, making sure all your iodine, folic acid, calcium, vitamin D, all the macronutrients, you're eating enough protein, you're eating the good essential fatty acids, DHA, EPA, and if you're doing a lot of training, then you can reduce the weight and then see how your body responds. And that would be one of the things, even when you go to the fertility clinics, and they will ask you all these questions as well. And if you, especially if you're obese, they will highly suggest you to lose 5 to 10 kilos depending on your how much overweight you are. So the common one between the men and the women, one is a smoking. Smoking damaged the shape of the sperm. Underweight and overweight, that is found in both male and female. Celiac disease, it's the disease in the gut lining where especially it happens when you're allergic to gluten. And so it's the inflammation in your intestine lining which can happen with the gluten. So if you have celiac diseases, that can also increase the chances of the infertility. So the best thing is to avoid the gluten for a while and see. BMI less than 18.5, which is seen both extreme training, especially combined with the low calories, that can also impact on fertility. Then the metabolic syndrome. Metabolic syndrome is a combination of high blood pressure, high LDL, I think waist somewhere around more than 40 centimeters, and the diabetes or the insulin resistant. Smoking, put it twice. Vegan diet is actually one of them was too. I personally believe the vegan diet could be because people are not eating, maybe not meeting some of the macronutrients, especially like the zinc. Zinc is really important for the men, for the testosterone and for the sperm. And then the vegan diet could be low in zinc, could be low in iodine, could be low in iron. So yeah, it's not that the vegan diet, it can be still designed properly, but you still gotta make sure you're meeting all the macronutrients. Crash diet, which I have done many times before, that you would be like, sir, I will be consuming 3,000 and suddenly I will start consuming 1,800 for like 3 months or 4 months. And then yeah, it can, especially the female, it really impacts a lot. Drugs, extreme stress can also impact on your fertility. Oxidative stress. Oxidative stress is actually in both male and female. It decreases sperm motility, it damages your chromosomes, it reduces the ability to fuse with the egg, the sperm. And the best thing to reduce the oxidative stress is to eat the food which is rich in antioxidants, especially the fruits and the vegetables. And that's one of the best things you can do it. If you want to conceive the baby, make sure you're eating a lot of vegetables, like 5 to 7 serves of vegetables, 2 to 3 serves of fruit. And not just for a day or week, like especially the sperm, it takes somewhere between 72 to 90 days to mature. So anywhere 3 to 6 months before conceiving the baby, you should make sure that your diet is really healthy, high in vegetables, then 2 to 3 serves of the fruits, and then you're meeting the essential fatty acids, especially the EPA and DHA, which is found in the fish. That I will make another video about the DHA for the women. It's really important for the infant health as well. Alrighty, let's start. Let's talk about men now. So one of the reasons is a low testosterone or injury to the testes, low level of zinc, which we discussed before, estrogen exposure, because again that can impact on the testosterone as well. Steroid abuse can also impact on your sperm count plus sperm motility, both. And then another one is the high intake of the soy. There you gotta be consuming like really in a large amount, and that's because they will increase the estrogen and they can drop the testosterone, which can impact on the fertility. But again, same with even in men, though there is no specific age for the like in women, the age above 35 decrease the chances of the conceiving. In male, there's no such age, but having said that, still above 35, above 40, it can impact on your sperm motility, sperm shape, the number of the sperms, depending on your lifestyle, depending what kind of the nutrient you've been eating, depending upon what kind of things you've been exposed to. Like if you've been exposed to the lot of pesticides, a lot of pollution, that can also impact, and that can happen during the over the number of the years. And that's it, guys. One thing, guys, before I finish, for any couple out there who wants to conceive a baby, 3 to 6 months before, they should make the nutrition and the lifestyle their priority. That means they should make sure that they're meeting most of the micronutrients, especially for the women, like the folic acid and the iodine, and the DHA is very, very important. For men, zinc is very important. Making sure their weight is in a healthy range, they're not overweight, they're not underweight. Make sure that they're not training to the extreme as well, like training 7 to 9 hours of aerobic kind of stuff. That can also reduce the chances of the fertility as well. And if you guys live in a pollutant city, then there's nothing much maybe you can do it, but maybe then you can make sure that you eat a lot of antioxidant food, and maybe have a air purifier at home. I don't know. That's it, guys. These are some of the reasons. If you think that anything which you can change it, you're most welcome to apply in your life, and you can also do your own research. That's it, guys. Thanks for watching my video, and if you haven't subscribed my channel, please do it now, and I will see you next week with another video. Thanks.